Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic, and we have a wonderful guest with us, Dr. Jeffrey Haddad.
Welcome, good evening.
Welcome to the show, Doc.
Thanks for having me.
Yeah, well, thanks for being here. I'd like to start the show with a scripture, John chapter 8, verse 32. When Jesus is talking to his disciples, he says, "If you hold to me and my teachings, you are really my disciples, and you will know the truth, and the truth shall make you free." That is that classic scripture. The truth sets us free. Sometimes we don't like to hear it. I know I don't always. But
the truth can hurt sometimes.
But, boy, it's part of pruning. It's like pruning a rose bush or something. Ouch, But, it's going to be good for you later on down the road.
Absolutely.
And that's what we're all about tonight, is sharing simple truths of nutrition. We just listened to Focus on the Family, and now we're going to focus on our health. And we would invite any callers to call in with dental questions. We're going to try to save the questions tonight to pertain to the dental or mouth or questions like that.
Yeah, that sounds good.
Now, Doc, we were talking the last couple of shows about these artificial sweeteners or high fructose corn syrup, and I thought of you. I was doing research on it. You know what I love about I'm donating our time. We're donating our time together tonight to share the message of truth and health. Mm-hmm. And we were talking about mercury, and I'm learning a lot from the show too. It's almost like what you put in, you get out.
The research is amazing, because you think quote unquote it all, and then you start learning some things that you had no idea that affected really our jobs day to day. So no, I'm enjoying it as well. I agree.
Yes. And one thing I didn't know about the high fructose until that 50% of the samples taken contain high levels of mercury. So we're getting mercury poisoning.
Unbelievable.
From high fructose corn syrup.
We can't get off this mercury subject, can we?
No, I love it. But, and then we were talking about, I didn't get to like sorbitol yet, and there's so many other artificial sweeteners that are bad for us and cause digestive problems. Mm-hmm. But the two worst are the sucralose and the aspartame.
And they both have mercury in them.
No, actually they don't. Just the high fructose corn syrup does.
Gotcha.
Okay, it's part of the processing. The less we do, keep it simple. The closer you get to pick an apple off a tree and eat it, pluck a carrot out of the ground, wash it and eat it. That's just, nothing is better than that. When you try to put it in a pill, or you start processing and heating and adding chemicals to make denature the molecules, it's just not cool. But aspartate and glutamate, which is in the aspartame, when that is excitotoxins. So it doesn't have mercury, but what it has, one thing, methanol. We're getting a high level of methanol, and that accumulates in your body. So, everything in moderation. You have a little bit. We shouldn't worry about it, because, stress affects our bodies worse than sometimes eating some junk food.
Right.
If you're going to have the junk food, just don't worry about it, and just keep it moderate, and do a liver cleanse or do a fast once in a while to get rid of this stuff. But it's the accumulation. When you start doing something regular, and we're so caught up with zero calories, right? And like Splenda, the sucralose has a lot of free chlorine, which is very toxic and poisons us, and is a carcinogen. And then the methanol and the aspartame and the high fructose corn. I mean, when you start using stuff over and over and over, and what happens is like you were saying, it slows down your metabolism.
Right.
We were talking earlier before the show, and it does. It slows down so even though it's 0 calories, it slows down.
It's a catch-22. You think that you're doing something good, when in reality, you're better off just eating the sugar and taking the carbs, I mean, and going for a run.
Well, the greatest thing is, dates or honey. And the honey, because when you take these sugars, you want it to be nutrient rich. Okay, so honey is loaded with B vitamins, pantothenic acid, minerals, you name the vitamins, and we don't even know all the benefits of honey.
Really?
It's and then you feel satisfied, and that stimulates the leptin release, the hormone that says, hey, I'm hungry, I'm fine. Where all these artificials that are nutrient void, they actually deplete nutrients out of our bodies to dissolve them, try to break them down and figure it, because they don't dissolve through the natural process, that digestive process. The liver has to do it. Mm-hmm. Then you get a fatty liver, and then you get the cholesterol buildup, and it's 0 calories. Right. That is why we're becoming more and more obese as we're doing all this, sugar-free and all that. I know you're probably like the sugar-free as a dentist.
Well, I do, but... And I like it because, I like to try and keep in shape as well, and I get, sucked into that whole 0 calorie thing too. But, really, one of my big, disclaimers, as far as a dentist is when I ask somebody, well, are you a big pop drinker? And they say, yeah, but only diet. And they think that that's good for their teeth. Well, it's better from a sugar standpoint. However, the acid that's in a Diet Coke is just as powerful and destructive as the acid in the regular Coke. So keep that in mind when you're trying to, cut down. Appreciate the fact that you're cutting down on the sugar, but that acid breakdown in the carbonated sodas and a lot of these other carbonated drinks is just as destructive. Red Bulls and good Lord, I mean that just will dissolve teeth. I mean I grew when I was going into college. It was pretty much common for me to go to the library with a Mountain Dew and Chewy Sprees, to stay awake. And my patients hear about that because I'm paying for that now. And, and now, I mean, Red Bull is so prevalent in society. It makes Mountain Dew look like child's play. It's just so much sugar and the acids, and I mean it's not only bad as just overall from a I'll throw the word out poison because that stuff cannot be good for you. But I mean from a two standpoint, it's just as bad. So we got to be aware of those things for sure.
It's really a downward spiral. I'm just really feel sad how many young kids are drinking that.
Oh yeah, I mean it's
why are our young kids? When I was a kid and even through high school, and nobody drank coffee.
Right
now, it seems like fifth graders are drinking coffee and Red Bull.
I know.
Why are they tired? I mean, when we were kids, we had a lot of energy, but
it's true.
You don't want the empty calories. Now, if you do, stevia is 0 calories. Are you familiar with stevia?
Yes, I am. I know. I've heard really good things about that.
Yeah.
So no,
it's a great substitute.
That's good to know. Very good to know.
But getting into that, we talked about I'd like to talk about digestion. Mm-hmm. We talk about digestion really begins in the mouth. Important. Chewing. Chew your food, chew it again.
Right.
As you know, saliva, the enzymes.
Oh yeah.
Start breaking down your food. And I see, I know we talked about mercury and we really pounded that one that, hey, if you have mercury fillings, please get them out.
Yeah. Well, we reached many people. I'll tell you, I have had several patients, listeners become patients since we've been talking about this.
Wonderful.
And it's great. They're on the path to start getting a lot of these old mercury fillings out.
Yes.
And again, it's just like we talked about before. When we look at with some of these older fillings, mercury aside, they need to leave.
Yeah.
mercury involved, they need to leave. I mean, these are just problems waiting to happen. And again, we've talked to several times to our listeners about just there's better materials out there. There's just better choices. So
better choice.
Yeah. So give your mouth a chance to have a better choice. And I love it when we talk about nutrition and just function in general. And I think that's kind of going to segue nice into our topic tonight, because when you have problems with your teeth, as you and I have talked about, and you can't properly process your food and function, and maybe you can't even eat those nutritious foods that I know you advocate every week. Right.
It requires some serious chewing.
Yeah. Unfortunately, the very unhealthy, high carb, non-nutritional stuff, it's pretty easy to eat, and you don't, unfortunately, but it's not good for your body. And so, when I see patients who are having trouble functioning, whether it be because their teeth are hurting, some of their restorations are failing, and I think what we're going to talk about mainly tonight, if they've lost teeth. You start losing teeth, we got a problem. It's a big domino effect. And, a lot of patients I see every day that they have no back teeth. And they think that because they have their front teeth, people don't really know and they're okay. Well, your front teeth aren't meant to chew. They're not. I mean, they're meant to tear food, but you need to function and really masticate and mash them up so that you can digest it properly.
Sure.
And these people their quality of life is below par because they can't properly chew the nutritious foods that you and I recommend to them. And so dental implants is really what I want to talk about today. It is not only the future, it's the now. I mean, this is one of the best options in dentistry that I don't think a lot of our listeners, and I know a lot of patients, aren't even aware is available to them.
Yeah. Well, I'm glad you're bringing this up because I wanted to get to this too. When you were talking about the amalgam fillings, they're like a wedge. When you want to split wood, I did a lot of wood splitting. We used to have a wood burning stove, and you put a wedge, a metal wedge, and you hit it with a hammer.
Oh yeah.
Right, and finally the wood splits.
Yep.
Right. So, and that's what you were saying the fillings do. It's a wedge.
You got it.
In your tooth, and you come down on it. Eventually, it's going to split into. So, what do we do for patients? Because that is a serious thing. It's not a cosmetic thing. It's a nutritional thing. When your bite is off or your teeth aren't masticating and you're not going to be assimilating the nutrients as well, right? So when the tooth is split, it dies, and we need to replace, when it's gone, dead, what do you do?
It's a good question, and even before we get to that, I think it's a good reminder to patients, your teeth shouldn't hurt. Okay, if you've got a tooth,
they should not hurt.
They should not hurt. When you're chewing, I hear all the time, like, oh yeah, I just don't chew on that side. Well, something's going on there, right. and whether it is maybe an older filling, some of the early warning signs of a filling going bad is pain when you're chewing, cold sensitivity when you're just drinking, normal, hot or cold, anything. Teeth should not be temperature sensitive either, unless there's an irritant or some underlying problem there. And so, please know that these feelings are warnings. They're warnings that something bad could happen. And unfortunately, I have patients who unfortunately wait too long, and they do have that wedge effect. They come down on that old metal filling that's been expanding over the years, splits a tooth in half. And the first thing say, all right, well, doc, how can you fix this? Can you put a crown on this? Actually, Mr. Smith, I can't. This split goes below the gum, and we're going to lose this tooth, unfortunately. And patients are always, regretting, why didn't I get this done sooner? So don't put yourself in that situation. But if you are in that situation, or if you have already lost some teeth, which, the stats out there, I believe 67% of patients, once they reach the age of, I believe, 45, have lost at least one tooth in their lifetime. And
so by the time you're 45, you've lost one
tooth. And, I've had, the other stat is, about 25% of the patients when they're in their 70s have lost all their teeth. Now,
wow,
this is scary stuff. By the time
they're 75, have lost all their teeth.
That's correct. And with all the advances in dental work, it shouldn't happen. And now, if you are in that situation, and I think that today is going to be a show, I'm hoping to enlighten a lot of people out there who have been suffering with maybe no teeth or less teeth than they started with, or ill-fitting dentures, because dental implants could truly be the key to getting you back to function and quality of life. That it is such a amazing technology, and we're able to replace a tooth that is, I hate to say as good as your original tooth, but pretty darn close.
Pretty close to it.
Yeah, I mean, and so non-invasively too. It used to be a big surgery and very big, involved procedure, and it's not anymore. I have patients that I place an implant in their mouth that day. That night, maybe they take some over-the-counter anti-inflammatories, and that's it. It is just so simplified, and the technology we have right now
you
is
don't have to refer them out to an oral surgeon. Is that what you're saying?
No, that's a good question, actually. No, oral many people in dentistry can place dental implants. You have your oral surgeons, you have your gum specialists, which are called periodontists. There's even some root canal specialists that are starting to do implants. But I'll tell you, the majority of general dentists have the choice to do their own root canals, take out their own teeth, place their dental implants. They just need extra training to do that. And I chose to continue my training. And, we've been placing dental implants in our office for almost 20 years. It's nice. Our patients appreciate it. As you know, I have very, very loyal, trusting patients. I mean, they trust me. They trust you. When you have that relationship, it's a special thing. And when they have to leave and go to somewhere else to have, something done, they don't like that, So when you're able to provide that procedure to them, they love that. They want to have it done there. So for us to be able to place the dental implant from a surgical standpoint and then replace the crown on top of that, we literally rebuild the entire tooth from the ground up.
So what is how do you do that? You said you put in a post.
Yeah, that's a good question. A dental implant, a lot of people, it sounds a little scary. Dentistry, a lot of the unknown can be scary.
Right. Well, this is great though you said you don't have to go to an oral surgeon. Do you put the patient under?
No, not at all.
So they don't have to go under anesthesia?
No, correct.
So
this is local anesthetic.
Local.
To be honest, it's less invasive than extracting a tooth. And in some instances can even be less invasive and problematic than even having a root canal done. And so it's what we do. We locally anesthetize the patient, so they're very, very numb. Obviously, there's no pain involved, and we are placing a titanium screw into their jaw that we will eventually, even sometimes that day, build a post upon and put a crown right on top. And it depends on the person. We have patients that, if they're a certain candidate, we can build from the bottom up. Same day, they leave with a tooth.
Wow.
Other people,
same day,
they get their tooth replaced.
So it's not you put in a post and come back a week later.
In some instances, I think on the average, what I like to tell patients is, on average, if we're going to place an implant, a lot of times we do want to wait. Usually somewhere between 3 to 6 months. I usually recommend 4 months is about the time that we want to make sure that everything is healed, and it literally fuses with this titanium screw. It's going nowhere. The success rate of dental implants is 97%. That's outstanding. I mean,
that is high. Disc surgery is, according to the American Medical Association, 10% success rate.
Yeah,
and according to the federal government, they have a 1% success rate for disc surgery.
How scary is that?
That is scary.
Yeah.
Chiropractic is we have an 86% success rate.
Perfect.
So that's according to the federal government study, treating disc problems. But now you're telling me you have a 97% success rate.
It's such an excellent prognosis, and for patients. And, let's compare the alternatives. You've got
whenever you go elect for surgery, it's always nice to know what is the success rate.
Without a doubt. And
how do you rate that? Are you 50% better? Is that success?
Right. In this case, it's pretty easy. If the tooth is replaced and still there, then we're in good shape.
Yeah.
It's a very cut and dry success, or failure there. But it's interesting because I guess norm a lot of times is what's called a bridge. And, you know, whether it's a removable bridge like a denture or a fixed bonded bridge, a lot of times what it entails is taking 2 healthy teeth on each side of a space, milling them down and putting crowns on them with a crown connected between the two, literally bridging that gap. That's where a bridge comes from. And the success rate on those after 5 years is 75%.
Yeah.
After 10 years, it goes down to 50%.
I would imagine the 2 teeth around it have to be shifting a little bit.
There's all kinds of things, you know. And you think
bacteria starts growing, and that's just a
one of the biggest
nightmare.
One of the biggest problems is you've got.
I would
teeth.
not want a bridge.
Well, and and I got to be honest, Joe. There are some instances where a bridge really maybe be a better option than a dental implant. Let's say you do have 2 large silver fillings on each side of the space. Well, you're kind of killing a few birds with one stone in that instance. We're going to be protecting those 2 teeth of the crown, and then we're going to be also filling that space. But I have to agree with you. When it all comes down to it, most people, when given a choice, would rather have a tooth that replaces their original one that they can floss and treat like their natural tooth.
Sure.
And that's what it does. I mean, it's the closest thing that you'll ever have to your original tooth. And it's just an amazing piece of technology, and it's just such a great option for our patients who some people don't even know they exist, you know. And I think that one of the best things that I love to do with these dental implants are patients who have already lost all their teeth.
Yeah.
And they've kind of, they've almost given up because they've got these dentures that are flopping around. They're embarrassed. They can't eat the things they wanted to. Things are clicking.
Right. So you're not eating, you're not digesting your food as well. You're not eating the nutritional dark leafy green salads and things you need to chew.
You don't have the choice. I mean, it's just so difficult to eat. You know, so many people make jokes about, oh, I just wish my teeth are such problems. I wish they were all out and you just give me denture stock. And people, please listen to me, that the best set of dentures I could ever make for you, and I'm pretty darn good at making them, are about half as good as the worst tooth in your mouth. And that is no exaggeration.
Is that right? Wow.
Listen, there's no replacement of your natural teeth. And so please take care of them is my first, recommendation. But secondly, if you do though, if you're already there, if you already have dentures and they are ill-fitting and you're having trouble, dental implants could be the key to changing your life. And I've seen it happen time and time again. We literally can take somebody's present dentures that you have right now and essentially anchor them with these implants that will, from day one, you will be eating things you haven't eaten in years. Unbelievable.
Wow. So what is you put in like a post, a screw. Mm-hmm. And what is that made out of?
It's made out of titanium.
Titanium.
And I know what is going through that head of yours right now. I
titanium.
Can see it. Very, very good biocompatible metal. It is been proven time and time again. In fact, even if you talk to the holistic, truly, truly extreme holistic dentists and doctors out there, it is as acceptable as anything.
Safe. It is
absolutely.
I tell you what, you have my stamp of approval.
I appreciate that. And that's
titanium. Yes, and you know how picky I am.
I know you are.
So titanium is good. Are there any
There's no
other
corrosion,
choices?
Nothing like that. Well, they have been working on a zirconium implant as well, which is truly ceramic. There are some drawbacks. It's still titanium's still the standard of care here, and
it's kind of like the fake diamonds, right?
Yeah, right. There you go. There you go. They don't look as nice though.
No.
But it is. And people do so well with them. And I'm gonna tell you, Joe, I just see people's lives change after these procedures because they really have just gotten to a point where they've accepted the fact, or kind of thrown in the towel of, yep, I can't eat what I like anymore. My teeth are gone. If you are even considering this type of option, or want to know that if you're a candidate, as always, I always recommend people go to our website, RochesterAdvancedDentistry.com, or you can call our office at 248-656-2020 for a consultation. Right. There's a lot of things that we take in consideration when we're seeing if you're a candidate. We can tell you right then and there, A, if you are a candidate, and B, what it would entail, the procedure, the timeline, everything. Information is power. Worst case scenario, you leave knowing that there's a possibility for you, and if it's something that's appropriate for you, great. If it's not, you're not going to hurt my feelings. I just want to make sure that people know their choices.
If it is, wouldn't you at least like to know? I tell people that about chiropractic. If you had a problem, chiropractor could help. Wouldn't you at least like to know? And if you're a candidate for a post,
dental implant,
one of these implants, and you're saying it's the same day. You can go in there. They can leave with a tooth.
In some instances, they can, which is amazing. And in others,
especially if you don't let it get so bad.
Right. And then other instances, we do have, there's a healing period there,
Okay.
But again, we would discuss it that day. We would be able to tell somebody that day if it was the right position of the tooth, the person's bite. There's a lot of things that we take in consideration here. But, at the end of the day, you will have a tooth that is replacing that space that, like I said, is as good as what you had before.
Fantastic.
It's an amazing
and then you
thing.
can begin chewing, as you said, like you're supposed to.
Get back to life.
Get back to eating the good, nutrient-rich foods that require chewing and the alignment of the jaw.
Yep.
That's phenomenal.
Yeah, it is. And,
especially with the materials that you're using that are safe and not intoxicating us.
This is something that is has changed dentistry and will continue to. Because
that's great that you've got the advanced equipment at your office to do these procedures.
You know that we like we like our toys in our office, and it's I'm a big believer of if there's something better out there for my patients, I need to learn how to do it, and that's why I'm always in school, as you know, and so we want to make sure that we're giving our patients the best, and we're trying every day.
Hey, I wish you would blog us or send us some info on our website, too, on Simple Truths.
We can do that. We can do that. As of right now, as you know, we have a link right to our website as well, which is great. And the Simple Truths for HealthyLiving.com. I love it. It's building up every single week. I'm just more and more content.
Yeah.
And it's again, information's power. The web is a very important tool, and that my website is my baby,
right.
Rochester Advanced Dentistry.com. I put a lot of time and effort into it, and it helps a lot of patients. It helps them educate themselves prior to even coming into our office, which is nice.
Hey, so if you are thinking of if you have a missing tooth or if you have dentures, very important to have good solid teeth. That you can sink your teeth into as you're eating nutrient-rich foods.
Amen.
I want to say that you can get a hold of our website, too, at simpletruths.com and simpletruthsforhealthyliving.com.
Mm-hmm.
We have a link for Dr. Haddad,
mm-hmm.
Rochester Advanced Dentistry there, to call his office direct.
Correct.
And remember that all that we eat, drink, or do all things to the glory of God. Everyone have a great night's sleep, and we'll see you tomorrow.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.